My aunt, who had been in this country for fewer than 15 years, and she had two teenage children, had detected herself a large mass in her breast. She had no health insurance. She didn't undergo any screening, and it was unfortunately quite advanced stage by the time that she had found it. Unfortunately, she passed away. So for myself, seeing firsthand growing up how all of these cultural factors, health access factors, as we've talked about, language, knowledge, beliefs, how they all sort of, and the system in general, how they shape together and interplay together to shape our opportunities for health, was a major question that I really wanted to address. Our major goal was to document patterns not only by specific Asian group, but also by their immigrant status. And this has not been done before, at least not in the rigorous way that we've looked at it. So what did we find? Our results point to vast differences in breast cancer stage and survival by immigrant status. In all of the groups, foreign-born women were more likely to be diagnosed with advanced stage breast cancer than U.S.-born women. Once we accounted for stage and other clinical factors that are known to influence survival, we found that foreign-born Chinese, Filipinas, and Vietnamese were more likely than their U.S.-born counterparts to die of this disease or of any cause, as high as a fourfold difference among the Vietnamese women. One sure way to ensure that we optimizes our chances to be diagnosed at an early stage is to be screened. For many immigrant women, this means creating the opportunities for women like my aunt to receive the life-saving screening that they may have otherwise not have had access to. Large numbers of API women, especially foreign-born, are not getting screened. Unlike other populations, they are significantly behind in meeting the Healthy People goals for mammography screening. So clearly this points to the fact that we still have a lot of work to do. We need to understand the reasons why not all women get screened, whether it's not knowing about the screening opportunities, lack of knowledge, lack of resources and access, fear, cultural beliefs. And then we need to take this knowledge and figure out specific cultural ways to reach the women and to convey the message that early detection can save lives.